to those families who have loved ones at these facilities who feel they're not being transparent with these families and the public?
Yeah, I mean, I think for the families, it's the hardest time, right? They are on the outside of these facilities. They can hardly visit their loved ones. And I will say that many of the facilities have done a really good job of trying to actually give a daily or a couple times a week update. I would be surprised if family members were reaching out to facilities and not getting information about their loved one. But I think, you know, this is a really, really challenging situation for long-term care facilities. And I have increasingly been saying, yeah, if people have been asking the question, what advice would you give to facilities and to families? And one of those pieces of advice is that there's not much that we have been able to do to really prevent these outbreaks in long-term care facilities. We're at 18 now. I suspect that there are more. I think that as we have expanded access to testing, we're going to see a number of other outbreaks. And it's not because people are doing anything wrong. It's because this disease seems to transmit much more than we realized at the beginning of this pandemic before you have symptoms. And so there's just no way to put up a defense against asymptomatic transmission in facilities that weren't built for that degree of infection control. So I would say, you know, make sure that you're communicating as much as you can with your facility. For some families, if they have the option to bring their loved one home, this would be a good time to do that. I know that's extremely difficult, and the reason that most of our long-term care facility residents are in those places is because they need the daily support. They need support with their activities of daily living. They need you know, extra help and bodies to be able to just help them get through their day. So I don't have better advice than that. I understand and part of my role in this, and as we communicate and manage co-manage these outbreaks with the administration of facilities, is to help them remember, like, we've got to keep families updated. You've got to help them stay in the know, because otherwise that's going to create a lot more anxiety and fear throughout our community.
Throughout the investigation at these outbreaks at these nursing facilities across Henrico and Richmond, have you been able to determine if staff members were by chance carrying the disease with them and therefore leading to the infection of other residents there?
I think in the majority of cases, this is happening because of healthcare workers who bring the virus into these facilities. Again, not knowingly. I think that all of these facilities the first or second week of March adopted the CMS recommendations to restrict visitation and to start screening their staff for symptoms. And you know, every time we have a new outbreak, they're doing all of those things. I think the reality that you are spreading disease before you know you have it is what is making it next to impossible for facilities to keep it out. At some point, we will have access to rapid testing, and I can very much envision a situation where every day a healthcare worker shows up and they have either a finger prick or a swab test that comes back in 15 minutes, and if it's negative, they can work, and if it's positive, they can't. But we're a long way from that, and so this is why, you know, when people ask me what still worries you most about where we are and where we're headed, it's our long-term care facilities. I mean, there are things that we've learned from the experience with Canterbury Rehab and things that Dr. Wright has really helped his colleagues learn, but none of it is 100%.
Dr. Evelyn,
So.